how do you deal at a national level. What does India need to do? Very quickly, we're just 2 minutes. If you could say 2 or 3 things that India needs to do to ensure that whatever the new developments, new diagnostics and treatments that have happened can be spread at a cost-effective manner and accessible.
So I think just taking it from the awareness question, the ICMR did a survey and they found out that 64% of people who had symptoms of TB did not actually go and seek care.
64%.
So 64%. So there were a various number of reasons for it, but the lack of awareness about symptoms and where they can go and seek care was actually not available. So if we can make information more readily available, make it more easier to consume, even probably direct people to where they can go and get themselves tested, for example, can make a whole world of difference. With COVID, we could actually just tap into, we could just tell our district, our block, and find 10 centers where we can go and get ourselves vaccinated. Why can't we do it for a respiratory illness, which is so
you would want a
widespread?
TB net kind of a network, so you can actually track people.
Yes, it should be as simple as where's the nearest TB center, and you drop down and you're actually able to go and find that. The other piece on detection actually that you were asked earlier, today there are options of computer aided diagnosis. You have handheld AI using X-rays that frontline health workers can actually go into the community, do a quick scan, and they get the accuracy of that is so much higher, and you don't need a radiologist to actually read the piece, etc. So these quick measures can also really make a world of difference. And like Sir was saying from the BMC, they're actually going into homes and doing it. So can you use those mobile X-rays aided by AI to really fast track this whole process?
In fact, the fact that you mentioned it, I know Dr. Naresh Trehan of Medanta, who actually provides these. He's got a mobile clinic with these, super fast diagnosis, and I wish more people did that. But Dr. Shinde, we have very little, 30 seconds. Yeah. The lessons that BMC learned, 2 points that you would say that the rest of the country could pick up.
I would like to urge all people present here and through this platform of India Today, that first thing is that we should not have taboo about the tuberculosis. We should treat the people with tuberculosis very properly so that they come forward for the treatment. Second thing is that we should be more vigilant and try to report the cases which may have around us, like our maids, our drivers, and try to get them into the formal channel of detection and treatment. And third and most important thing is that Honorable Prime Minister has launched very ambitious program of Nikshay Mitra. Tuberculosis is a disease of poor nutrition. So if you are able to afford to provide nutrition to one person per month, around 1,000 rupees per month, that person will be named as Nikshay Mitra. And this support of this person for his nutrition is going to definitely take his nutritional level above, and it will automatically help him to fight the tuberculosis.
Wonderful suggestions. Last word, Meera, your experience, ek shabd bata diye.
As we heard about Dr. Pinto said BPAL regimen, about BPAL regimen. I don't know how many people are aware about TB. Like if I'm talking about BPAL regimen is very shorter regimen, less duration and free injectables. And the most important thing is zero stigma. अगर हम सब के बीच में BPAL regimen available है, guidelines में है, then why we are giving longer treatment to the patient? 18 to 24 months का treatment दें या 6 months का treatment दें? What patient choose? Patients के लिए क्या सही है? तो why we are not focusing on the BPAL regimen? मुझे लगता है हमें BPAL के ऊपर फोकस करना चाहिए. And हम TB को कैसे eliminate कर सकते हैं? Is that possible to eradicate TB by 2025? या इंडिया को हम फ्री कर पाएंगे? ऐसा हम सब जानते हैं कि अभी नेशन वाइड दवाओं का स्टॉक आउट चल रहा है, दवाइयाँ अवेलेबल ही नहीं है. एंड वी ऑल नोज अबाउट द सेकेंड रेजिमेंट जो है, सेकेंड लाइन ड्रग्स विच इज़ नॉन अफोर्डेबल फॉर मिडिल क्लास फैमिली. तो अगर दवाइयाँ जब अवेलेबल ही नहीं होंगी तो हम पेशेंट्स को कैसे ठीक कर पाएंगे एंड TB इरेडिकेट कैसे कर पाएंगे? तो माई दिस पॉइंट इज दैट मैं मैसेज देना चाहती हूँ हमारे इंडियन गवर्नमेंट को, प्लीज ब्रेक द मोनोपोली, प्लीज ब्रेक द डिलेड सिस्टम, डिलेड डायग्नोसिस एंड ब्रेक द मैकेनिज्म्स.
Excellent.